Okay, my name is Tamara Bonita, and I'm going to be doing a PowerPoint presentation on the ethical principles and guidelines related to social media and healthcare professionals. And I wanted to do a constructive focus, particularly for nursing students as they're entering their profession as nurses and medical professionals. So I wanted to start out by making a clear definition of what social media is, because there might be some students in the class that may not be as familiar with this particular topic. So social media is defined as the interactions among individuals where thoughts and information are created, shared, and exchanged in complex virtual, meaning computer-based communities and networks. Social media is different from traditional media like cable television, newspapers, radios, in several aspects such as permanency, quality, immediateness to access, and easy and quick usability. So, in other words, this is information that people can pretty much see instantaneously once they log on to some of the different social media sites. Social media can include, but aren't limited to, internet forums, web blogs, social blogs, and social networking sites. And some examples of these are Facebook, Twitter, YouTube, people's emails, and instant messaging. And I kind of wanted to go over some of the more popular sites just for some people that may not be familiar with all of them. For example, Facebook is probably the most popular. It is used by over 150 million people in the US and over 750 million users worldwide. So it is a very, very large social media base. Basically, it's a web page that people create. It's a profile online, and people have to make friend requests in order for people to be able to see and see other people's Facebook page. The website allows people to write random reflections, details about what they are doing, and pictures of just about anything that they want to post. People can view other individual sites, comment on writings and pictures, and share these findings with others. So basically, I don't think there's not that much of a limit as to what you can put on your own personal Facebook page, and then invite other people to view what you have put. Another example of a very popular social media is YouTube. YouTube is a video media site where any individual can post videos of their choosing and share it with as many individuals as they want. It was originally created to provide people with information, for example, like how to fix a flat tire, how to do anything pretty much. But over the years, people have included a variety of videos, for example, puppies playing, children at recitals. So basically any kind of video that you want to put online, you are able to put on this site. And the site also allows people to interact with each other and discuss various postings. So people, if your YouTube site is open, people can comment on what you have posted. Another example is Twitter. Twitter is considered a much faster version of Facebook status update. People that are logged in and follow other people's Twitter's account pretty much get their updates immediately. Postings on Twitter are typically limited to about 140 characters and are referred to as a tweet. Individuals can follow each other and receive information at an incredible rate of speed. It has become the hub of news and information exchange by users using a hashtag where they can discuss topics with each other in a united single stream. And then another site is LinkedIn. This website is over 120 million users. It is a website created for professionals to be able to create a profile to advertise their business and has become a live interactive page that displays one's resume. Viewers need to be requested and accepted as friends. This website has become the hub for companies and businesses to find potential employees and for individuals seeking jobs to find job listings with various employers. So how does social media affect the medical community? That's the big question. It has been shown that 35% of adults in the U.S. have a profile of some sort on a social media website, and that social media users number in the millions around the world. The growing popularity of social media over the years has increased exponentially, and along with this growth, social media has also opened the doors to a wide variety of legal and ethical concerns surrounding its usage by many businesses and a wide variety of companies. So in other words, I think it's not just the medical community, but basically it's any business also has lots of legal issues. So it's definitely not just limited to hospitals and private practices of physicians, but really any business. The professional medical field has certainly not been excluded from the social media explosion, and it has presented the medical community with a wide variety of new ethical and professional challenges. Social media can be a great way for healthcare professionals to communicate with each other, with other colleagues, and share certain healthcare information. However, doctors, nurses, and other team members should be aware of the prospective risks of using social media and how it affects company policy, patient privacy, and I think this is a big one that people forget is the privacy of the healthcare facility itself. The dangers of social networking in the healthcare realm. Numerous legal issues can originate from healthcare providers using any form of social media. These issues include, and these are just the three that I picked, and they're definitely not limited to these issues, patient privacy, fraud, medical fraud, and facility privacy. Clearly, number one, the biggest concern is patient privacy. HIPAA and state privacy laws put a limit on the ability for healthcare providers to interact with patients via any social media form. These same laws also prohibit the disclosing of any patient information without the patient's permission, which includes any information or pictures that can identify the patient. If in violation, the healthcare worker is subjected to fines and penalties under these state laws and even corrective action from the facility. So clearly that's an obvious one. You need to be aware of patient confidentiality, and that is definitely a big one. Another thing is fraud. Federal and state laws that are created to prevent fraud and abuse and that prohibit healthcare providers from giving third parties any information of value for the reimbursement of Medicaid and Medicare are highly vulnerable when social media is used in a negative way. So in other words, if you do have a patient that is a friend, let's say on Facebook, and it gets out that maybe a patient that is waiting for a particular transplant, like a heart transplant or lung transplant, liver transplant, you have a picture of the patient smoking a cigarette, or maybe the patient having a glass of wine at dinner. These are things that can be found out by these reimbursement companies, and are clearly would not be good for the patient. And those types of activities are, it's prohibited for healthcare workers to provide that kind of information. So that's another thing to consider. And then also facility privacy. Healthcare providers have to be cautious of the information that they post about the facility in which they work. Employees need to be careful about what they say, because their organization could be tied back to whatever it is that is said, whether it be positive or negative. This may result in unwanted publicity for the organization and other workers, and the patients contained within its walls. So in other words, if you go home and blog on Facebook or Twitter that you've just had a really bad shift, that you hate all your coworkers and you hate where you work and it's a horrible place, clearly that might be how you feel, and it's your right to definitely say that. But when you put it online, it's going to reflect negatively on your organization, and that's definitely publicity that they are not going to want for other future patients and family members to see, so you have to be really careful when it comes to stuff like that. I know that a lot of my coworkers have taken off of a lot of their social media pages where they work, so that they are not ever tied back to that kind of information, if they do post that kind of stuff. And so the last thing, and I underlined it and bolded it, just basically what I'm trying to say is just to use your common sense. The important thing to ask yourself is, where are the logical boundaries of professionalism, and is what I'm about to post violating the privacy and confidentiality of patients, other coworkers, and the healthcare facility? So in other words, if you're wanting to post something and you're kind of questioning it, then chances are you probably shouldn't post it. Either that, or get the advice of some other people before you post something. So basically just think before you post. And then I also wanted to go over just some of the principle and guidelines that the American Nurses Association has come up with. And again, we have to keep in mind that as social media is changing and increasing in popularity, a lot of facilities are trying to catch up with the technology, and so, there's new standards and standards and things that the facilities are trying to come up with as things kind of happen that like policies that they're trying to come up with to deal with certain issues as they arise. So these are just some of the tips that the ANA has come up with. Clearly, number one, nurses must not place patient information online. That's pretty obvious. Two, nurses must abide by ethical and professional patient-nurse boundaries. Remember, most places will have you sign a code of conduct, so you need to be aware of those and whether or not you're breaking that code. Nurses must understand that anyone can view postings of all sorts. Remember, just because you trash it or get rid of it doesn't mean it's gone. Once it's viral, it's out there, there are ways around settings so anyone can view what you post. Number four, nurses should take advantage of privacy settings and aim at separating professional and work information. It's pretty self-explanatory. Five, nurses should be obligated to report any violations of the privacy of patients, coworkers, or the facility. It is your obligation when you do see something that is someone else's posting that is going against the facility's ethical and professional boundaries. You need to report it. And I'm sure that every facility has a way, and I'm sure that it can be done anonymously too. And then six, nurses should be a part of policy creations of social media principles. So this kind of goes back to how we've been talking about in other classes, just, nurses need to be involved, in creating these policies. And, I'm sure a lot of facilities want your input on this kind of stuff. So it is important to not just sit back and complain, but to actually get involved. And then some more helpful tips from the ANA that I found. One, keep in mind that standards of professionalism are the same online. So, you are still considered a professional, at home, at work, and same online. Do not share info or photos that are acquired from nurse-patient relationships. It's pretty self-explanatory. Maintain your professional boundaries and question anything that blurs these boundaries. So in other words, again, just use your common sense. Do not make degrading remarks about coworkers or patients and that this reflects negatively on the healthcare facility. Pretty self-explanatory. Do not take videos or pictures on personal devices like cell phones. And this goes for, that's pretty clear too. And then also just to report any breach of confidentiality or privacy. And then at this point, I kind of wanted to get the class involved, so I kind of came up with some ideas just for some different class discussions. Basically, these were just my 6 things that I picked, and clearly, the class discussion would not be limited to to these 6 things, but just some of the things that I've come up with. What have been some negative, positive personal experience you've had with social media? So, I think when people are listening, when people share their personal experiences, it's always a lot more effective. People can share maybe some experiences that they've had at other workplaces or friends or families or whatnot. And then I think this would be a question that would cause some pretty big discussion is, are the concerns of healthcare and social media really that big a deal? So, are these facilities really blowing this out of proportion? Just kind of get some comments and feedback about what the class thinks. And then also maybe what are some positive things that can come from healthcare engaging in social media. So clearly there are some good things, and just make sure that the class is aware of those good things. And then this is something that I always like to share with nursing students and even just with new graduate nurses that I'm training. You think about how the patient feels. Like if you were a patient, what would be some of your concerns with social media? Put yourself in the patient's shoes, and how would you feel if somebody posted a picture of you in the hospital bed, all sick and whatnot. I think that is always very helpful to do. And then another, as a nursing coworker, what would be some of your concerns with using social media? Another question. And then just what is my role responsibilities as a nursing student when it comes to social media and networking? So thought that would be an interesting topic as well.